The Ashanti region, as it has for the past 2 weeks seen an increase in the number of new COVID-19 cases. Cases have increased from 20 to between 37 and 39. Deputy Ashanti Regional Health Director in charge of Public Health, Dr. Michael Roxon-Ajay, fears a spike of the virus in the region is if the blatant disregard for the COVID-19 protocols continues. He spoke with our correspondent, Beatrice Pilgabra.
For the past 10 weeks, we saw a downward trend of cases weekly from us. Just the past 2 weeks ago, that's week 22 and 23, we've seen a spike or an increase above the normal trend we've been seeing. Because averagely, before these 2 weeks I'm talking about, we had seen no more than 20 cases in a week. But the week 22, that is last 2 weeks, we had 39 cases. And then this week, we have 37. So clearly, if you compare to the trend we've been seeing, we are seeing an increase in the number of cases. When people have the infection and they breach protocols, or when people who are not even infected also do not protect themselves, and we mix up with those who are infected, we can also get ourselves infected. And one thing is COVID, a lot of people would have it, but will not show signs. So when we let down our guards by observing the protocols, and we breach them, then we are likely to see an increase or a spike in the number of cases we see daily or weekly. Currently, we have less than 1 million people who have received at least one dose. And if these people do not observe the protocol, as we see in our environment, because we have a lot of people thinking that are vaccinated, so I don't have to observe. The vaccination is only for you, because when you get infected, you may not fall sick because you are protected, but you will carry the virus on to spread. And then the general disregard for the protocols. The first thing of preventing an outbreak or limiting an outbreak is preventing exposure. We all decide to stick strictly to the protocol. Wear our mask, wash our hands, avoid unnecessary gatherings, social distancing, all that we need to do, cough etiquettes. Then you will not get exposed or